Hello and welcome back. I'm Dr. Alison with Little Black Bag Functional Medicine, and today we are starting something a little bit different. We're kicking off a 4-part series for the entire month of May on brain health, and specifically the brain of the mother, the woman in midlife, the woman who has been told over and over again that this is just what motherhood and hormones and life does to you. This is just aging. Your brain health is just part of stress. Just relax. And I'm going to tell you right out of the gate, this is not the conversation, obviously, that we're going to have here, not on this podcast, not for the next 4 episodes. And today's episode is called The Mother's Brain. And it's going to be the foundation that the rest of this month is built on. So whether you've been losing your words mid-sentence, walking into rooms and forgetting why, but for some reason you remember the lyrics from your favorite song from 1990, I don't know why that happens, reading the same paragraph 4 times, crying because you can't find your phone that's in your hand or your sunglasses on your head, and really just feeling like the woman you used to be has slowly gone missing on you. This is for you. And I want you to know, before we even go into root causes and science and what you need to start looking for, you're not alone in this, quite obviously. You're not over-exaggerating, and you're not too complicated. You're not aging out of your own life. So we're going to start understanding what's happening with our brain today. And before we dive in, our friendly reminder that I share at the start of almost every episode, that this is for educational purposes. I love sharing this information, but this is not personalized medical advice. It does not create that provider-patient relationship. So if you're working through any of this on your own, please do that with a clinician who knows your full picture. You can come find me at littleblackbagmedicine.com to start that new patient process, or my Mama Brain program that we're going to launch at the end of May. So all of this will be in the descriptor, but also the labs, the markers, the specific things we're going to look for will be transcribed on my blog at littleblackbagmedicine.com with the links as well. So if you're driving, if you're folding laundry, if you're hiding in the pantry from your kids while you listen to this, you don't have to take notes. It's all there for you when you're ready. So let's get into it. And I want to start with a typical woman who comes into my practice. And really, it's the women that I've been seeing over the past 4 years. You're 43. You have a few kids. You have a job you actually like. You have a partner that you actually like and get along with. And the first thing you say to me when you sit down is, I think I'm losing my mind. You told me that you walked into the kitchen that morning, forgot what you went in there for. A few times. Told me that you can't remember the name of your son's teacher, even though you'd just been at conference with them the week before. Told me that your husband asked what was for dinner and you cried because you couldn't even hold the question long enough to come up with an answer or think about the possibilities. You were just overwhelmed and shut down. So you go to your primary care doctor, your labs are normal. Everything's great. You go to your gynecologist, you think, oh, maybe it's perimenopause. But you're told nothing to worry about. Maybe you might have some hot flashes coming. Maybe they offer birth control or antidepressants, but really, that's just life. Maybe you've gone to a therapist who said you're stressed or you need to try meditation. Maybe you're told, hey, you need to sleep more. But how is that even possible when you're struggling with sleep in the beginning? Maybe you've tried cutting out gluten and cut out caffeine. You're taking B vitamins. Nothing is moving the needle. And by the time you get to me, you're not asking what was wrong. You're asking like, oh my God, is it always going to be this way? What else could be going on? So here's what I want every person listening to this episode to hear. Brain fog is not a personality trait. It's not a social media diagnosis of like a silly little ADHD, oopsies, or autism, or just simply the blanket, oh, it's perimenopause. Brain fog is not a phase of motherhood. It's not the natural consequence of having children, though sometimes it is. I know my pregnancy brain was horrible, but we are supposed to recover. It's not just having too much to do or having jobs or having lives. Brain fog is a symptom, and symptoms have causes. And in this case, we're going to break down 5 of them, 5 drivers that I see over and over again in almost every woman who walks into my practice with cognitive symptoms in midlife. And very few people are tracking these symptoms and understanding why they are happening, when, or how they're relating to your symptoms. So these 5 are going to be the framework for the entire month of May. We're going to take each one and go deeper into the science across the next 4 episodes. But today I want to lay them all out on the table so you can start hearing your own story inside this list, starting to put some pieces together, maybe even start tracking your own symptoms and realizing, oh, this happened 3 weeks ago. I didn't think it would make a difference, but it did. So the 5 drivers that we're going to talk about today are hormones, infections, sleep, mood, and insulin. So once again, hormones, infections, sleep, mood, and insulin. So you can write that down, but this list is going to come up over and over again. So let's dive in with hormones, because for most women at almost any phase of life, this is where the conversation has to begin, because estrogen is not just a period hormone. It is specifically estradiol, which is also a brain hormone. It supports the production and receptors of our major transmitters, like serotonin, which is for our mood and sleep, dopamine for motivation and reward, acetylcholine, which is our memory and our focus. So when estradiol drops, which it does in perimenopause, but also after ovulation, those neurotransmitter systems get less support. And the very first symptom we usually say before the hot flashes, before the cycle changes, are the brain ones, the cognitive ones, the word finding, the memory, the attention. So there's research from Cornell that has actually shown this on brain imaging. Women in perimenopause show metabolic changes in their brain that look more similar to early Alzheimer patterns than they do chronologic aging in men of the same age. There's a 2017 paper in Neurology that tells us that perimenopausal brain is in a real, measurable transition state. So it's not in your head, it's actually on the imaging. And then we have progesterone, which is the brain's primary calming hormone. So progesterone metabolizes into a compound called allopregnanolone, which acts on your GABA receptors, the same receptors that calm anxiety and help you sleep. So when progesterone drops, which happens in perimenopause usually before estrogen does, and then at the end of your menstrual cycle, you lose that calm. You feel wired, you're waking up at 3 a.m., you can't turn your brain off, and that wired exhaustion is part of the brain picture too, because a brain that cannot rest cannot consolidate memory, which is also why insomnia during PMS and menstruation is also so common. And we can't leave the thyroid out of the hormone conversation. Thyroid hormone is specifically the gas pedal for your entire metabolism as well, including the metabolism of a neuron in your brain. So here's something to take a note of. A normal TSH is not the same as an optimal thyroid. So many women are walking around with a TSH at 4 or 5, even sometimes as high as 9, and being told that's normal. Yet their free T3 is bottoming out, their reverse T3 is elevated, and their brain is almost literally starving for thyroid hormone as well as every cell in their body. So the thyroid and the estrogen are kind of like toxic coworkers that work together, which is why we need that full thyroid panel from a free T3, free T4, reverse T3, antibodies, thyroglobulin antibodies, so we can see that full picture. The second driver I want to talk about is infection, and I feel like no one is talking about it, in my opinion, and it's the most under-recognized cause of brain fog right now in midlife women. Honestly, this podcast was kind of directed more towards moms in midlife, but I'm seeing this across the board from 20-year-old women to 80-year-old women. And I want to be clear about what I mean by infections. We're talking about chronic, often hidden, even reactivated infections that are driving inflammation in the brain, from Epstein Barr reactivation, long COVID, mold and mycotoxin exposure. We have Lyme disease and co-infections like Bartonella and Babesia. Then we have hidden yeast and gut dysbiosis. reactivated cytomegalovirus and herpes virus. All of these can impact your brain. They do impact your brain. And why I state that no one's talking about it is because women come to me and they say, hey, I have this new storm of symptoms. I was doing so good and then everything fell apart, but my labs are normal. Nobody knows what to do. I've seen 5 doctors. Alison, what's going on? I'm like, crap, I wish you had come to me first, because what I'm doing and other functional doctors hopefully are also doing is going, okay, when did these symptoms start? Okay, when was the last time you had COVID? When was the last time you had the flu? When was the last time you had your Epstein Barr PCR check? And they're all saying, well, I was sick in January. And I'm like, oh, well, there's our answer. And I see this with flares as well, whether it's lupus or Ehlers-Danlos, where someone comes back, they're like, I have this huge flare. I don't know what happened. I was doing everything right. And my next question is, okay, well, what happened? What's been happening the past few weeks? And they're like, oh, I had, norovirus like 2 weeks ago. I'm like, oh, there it is. Because once your immune system is activated, it's going to affect every system. And every single one of these infections can cross the blood-brain barrier or signal across it. They can activate your microglia, which are the immune cells of your brain. Those release inflammatory cytokines that disrupt synaptic function, how your cells are talking to each other in the brain. And that feels exactly like brain fog. So when someone tells me that they've had brain fog, they don't know why, but then we go back and look at, what does your cycle look like? When was the last time you were sick? When was the last time you had a tick bite? When was the last time you moved? Maybe you had a water-damaged house or something like that. I take that very seriously. So I have a little bit of a personal story to share here because I'm going to really dive into this next week. I've had Epstein Barr since I was in high school, and back then, I know, so long ago, I was told, well, you're lucky, you got it over with. You can only get it once. You can only get mononucleosis once in your life. And then I had it in college. And then I had it in college again. And I was like, what the heck is going on? I thought this was only a one-time thing. And then I kind of never really thought about it again. And honestly, it had probably reactivated multiple times over my life, but I had those 3 major hits that took me down for about a month apiece. And then after I had COVID in 2022, I developed mast cell activation syndrome with full body hives, head to toe. No immunologist, allergist, functional doc could help me for like almost a year. I developed asthma. I needed an inhaler. I developed POTS. I needed propranolol. I developed chronic fatigue and CFS. We were looking at ME as a diagnosis. But after a while, I got better. I had a protocol. We got it fixed. I was doing great. Then 2024 into 2025, I had a winter of a combination of viral infections. I had 5 separate infections back to back over that winter. And by the time the sun came up in the spring, I was toasted. I couldn't roll over in bed without my heart rate spiking to like 150. It was miserable. So last March, I was doing some research, and I have to give my husband credit because he was telling me about nicotine and the research and what he was hearing. And so I did a deep dive into that. I have a podcast back then about it as well, and started using nicotine patches. It took a long time, but I was able to free myself from POTS, which was huge. I got out of the house. I could go, I took my son to the zoo for his birthday. It was amazing. And I had a year of feeling like myself again. And then this year in February 2026, had COVID. And honestly, it wasn't the worst I've ever had it. And I thought, okay, we'll just ride it through. And here's the thing about post-viral effects that I want you to hear. They don't always just show up immediately. Like the classic timing when 2020 started and we were learning about mast cell, and everyone who's been talking about mast cell forever was finally like vindicated in all of our work. But it was a classic 8 days after the initial infection where hives would start, difficulty swallowing, headaches, skin issues, things like that. But it can also be weeks or sometimes even months. And for me, This time it was about 3 weeks. 3 weeks after I thought I was through it, that's when the long hauler symptoms kicked in. I had severe brain fog. POTS was in full flare. The chronic fatigue, that means I couldn't even stand up to load the dishwasher or cook. Cleaning was off the table. I just was exhausted. And it was something also where everyone I talked to was like, there's no more options. You just have to ride it out and keep doing all the supplements I'm doing. And I had a full protocol that helped me get through it that I'm going to share when we talk about viral and what to do. So I'm telling you all this because I've lived the very thing that I'm teaching about for the next 4 weeks. I had to run my own labs. I've done my own protocols. I've built my own routine, which is what we're going to share. I'm in the process of healing, and we're all going to spend next weekend's episode on that post-viral brain. But I want you to know right now, if your brain has done different since an illness, that is very real. It is treatable. You're not alone. And this matters so much because we're not asking what happened. When was your last viral infection? When did you have COVID? And the other problem I see is that when I ask these people this, they're like, well, I tested negative for COVID and flu A and flu B. I tested negative for everything. And I'm like, it doesn't matter if you tested negative because you were still sick. You still had something going on. Whether it was a different strain that's just not being tested for, it doesn't matter because we still have to treat the after effects of that, label or not. So these are the questions that are driving behind these symptoms that are getting written off as perimenopause or anxiety or stress or just not taking care of you. Speaking of taking care of you, the third driver we're going to talk about is sleep. And I think the problem is everyone just says, well, just sleep more. Get your 7 to 9 hours. Sleep is secure. I'll just go to bed earlier. And it makes me want to scream because, myself included, maybe we are sleeping 8 hours and you still wake up feeling like you got hit by a truck. Or your insomnia is so bad that it doesn't matter what time you put yourself into a bed and get tucked in. You're going to lay there for 4 hours until your brain goes, oh, okay, it's 2 o'clock. Let's go to sleep. It's not just a simple fix to say, hey, go get some sleep. So let's talk about what's actually happening at night. Your brain has a cleaning system called the glymphatic system. So it's lymphatic with a G. And this was discovered kind of recently by around 2012. So the glymphatic system clears metabolic waste out of your brain, including a protein called beta amyloid, which is the same protein that we know accumulates in Alzheimer's and also affects the kidneys. This system is most active during sleep, specifically slow wave sleep. So if you're sleeping 8 hours, but you're not getting that slow wave deep sleep, your brain is not getting cleaned. The trash is staying in. And the next morning you wake up foggy, even though your clock or your app says you slept enough and everything's fine, you feel like trash. Usually that's a cleaning issue and an immune issue. So what disrupts slow wave sleep? Number one, alcohol. Even one glass of wine can be an issue, which is why you notice your tolerance gets less and less as you get older. High cortisol at bedtime from either intermittent fasting, stress, other hormone issues, blood sugar that crashes in the middle of the night because your adrenals are off, your liver doesn't have enough food in it. There's so many reasons. We'll deep dive into that as well. Sleep apnea is a hugely underdiagnosed issue in women, and that's something I would recommend getting a sleep study done. And then, of course, we have hormone shifts, which can affect our neurotransmitters. It can affect anxiety. Maybe we have too much screen exposure in the evening, magnesium deficiency, iron deficiency. We can make a huge list. So if you're doing everything right and still waking up foggy, the question is not how many hours did you sleep? It's more about what kind of sleep did you get. And we actually have ways to measure this now with your wearables like Aura or your at-home sleep studies with actual sleep architecture testing if we need to go that far. But sleep quality is the real variable, and we can move that. So I want to add one more piece here that doesn't get talked about enough. Progesterone, which is we've already talked about as your brain's calming hormone, is also one of your major sleep hormones. So as progesterone declines throughout the cycle and then out throughout your life, women start waking up at 2, 3, 4 a.m., wide awake, brain working really hard, unable to fall asleep. And that is insomnia in the way most doctors are thinking about it. It's hormonal. And the work that we do with progesterone support, whether it's bioidentical progesterone, low dose creams, or pharmaceutical support, and then adding in the adrenal support and nervous system support, can absolutely move that needle. The last thing I want to mention here about sleep apnea and being underdiagnosed, feeling like it's almost criminal, is because women, of course, present differently than men. We do not always have that loud snoring or our spouse like knocking us because we have that break in breathing or the apnea or the obvious daytime fatigue. We present with insomnia, anxiety, morning headaches, fatigue with the brain fog. And then we go, oh, well, that's just stress, right? Or it's hormones. There's nothing we can do about it. Or here's some birth control. So if your sleep is fragmented, if your blood pressure is creeping up or you're grinding your teeth, get that home sleep study so that way you can get treated for what's actually going on and not just being told that it's anxiety or something else going on. And I want to pause right here. So if you're starting to say like, oh my gosh, this is so much, or wait, this is me, how did I not know this? Like, just pause, give yourself some credit here. This is not your job to figure out your health on your own. This is a lot of information. And the fact that you're here, you're listening, you're doing something to educate yourself about your health means something. It means that part of you knew that there was more to your story than just stress, just motherhood, maybe just aging, and that part of you is right. And we're going to honor that for the rest of the series. So you don't have to figure this out right now. You don't have to start a protocol or order 800 supplements right now. Just keep listening, follow along, keep learning your own story, start tracking infections, looking back at your history. When did you move? Where did you live? When did you get sick? What's going on? And keep asking these questions for yourself and have this as a chart for you to put these pieces together as well. Okay. So driver number 4 is mood. And I want to reframe this one for you because mood and brain cognition are so deeply linked that it seems like we can't really separate them. Depression and anxiety are not just feelings. They also have a deeply inflammatory component. And this conversation is very nuanced. There's a neurotransmitter conversation, which is hotly debated still. There's socioeconomic factors here where stress and lack of money, lack of resources, lack of support, those are very real things. And I don't want to portray this as, oh, if you have brain fog and you're anxious, then you just need to do this protocol and you'll feel better, because that means we're ignoring a lot of things. But for this podcast, for my work, we're going to talk about the biophysical mechanisms. And you know what? One of my number one referrals that I send most of my patients out for is good therapy and finding someone that you get support with, that cares about you, that's invested in your future with you, and navigating life's craziness. So recognizing that this is a multifactorial component to mood, we also want to give our brain the best support that it can. Okay. So the idea is there's an inflammatory hypothesis of depression. The serotonin lack of reuptake has actually been, I don't want to say disproven, but it's actually never been proven. It was a theory. The drugs seem to work, sometimes at different doses for different people, and we've stuck with it, and it's still incorrect. So I like to lean into the inflammatory hypothesis, the idea that we have these elevated inflammatory markers, cytokines like IL-6, that means interleukin-6, and then TNF-alpha actually drive depressive symptoms by disrupting this neurotransmitter availability and creating that low-grade brain inflammation, and then blocking our glymphatic system by overwhelming it so it can't clear. So when a woman is brain fogged, but also flat or anxious. That is not three separate problems. This is one inflammatory pattern wearing three different hats. So it's the same root cause work, the gut work, the infection work, the hormone work, the nervous system work, and addressing all of these together. So let's talk about the nervous system piece real quick, because it's impossible to talk about brain fog without talking about chronic stress and dysregulation. If your nervous system has been stuck in fight or flight for years, your prefrontal cortex at the front of your brain is your thinking brain, your planning brain, your word-finding brain is going to be operating at half capacity. This is not a personality flaw. It's not you being quirky, even though it might be. It might be for me too. That's all right. This is your sympathetic nervous system telling you that your body's survival is more important than executive function, than thinking, than being able to plan out a day. So the work here is real, but it's also the slowest, and it's also the most worth it. So this is when we talk about vagus nerve work, breath work, heat exposure, light, cold, maybe, time outside, movement, Reiki, somatic practice, whatever doorway works for your body, because we don't want to keep our body in fight or flight because we won't be able to heal. And this is why I created my neurobalance program that I give to pretty much every patient, so we can do the deep brain recovery work that also works on the whole body. And I also want to name something specific for the mothers listening, because this matters. The nervous system of the mother who has been holding everything for years has been in a particular kind of chronic activation that we really don't talk about enough, or we really do talk about it, but there's no way out, right? So the mental load, the constant anticipation of needs, waking up at the smallest sounds, carrying everybody's schedules in your head. You are the person that is co-regulating your entire house. Your calmness, your steadiness, your ability to hold everybody's needs and emotions and feelings and stress within yourself so they can feel better. That is not helping you feel better. So this is like a unique flavor of co-regulatory sympathetic dominance. And it's part of why so many women have hit a wall around the time your kids are 8, 10, 12 years old. The nervous system has been on for a decade, or really your whole life, maybe even from childhood. And then we have a hormone shift that removes some of the buffers like estrogen that was keeping it managed. So if you feel like you've hit a wall and you can't understand why, this is part of the answer. And really think about the overstimulation that comes with parenting. I laugh because we have a new puppy, and then our two puppies, or we have two dogs, they're growling and they're play fighting and they're making a lot of noise, and the TV's on and my husband's phone is going off, and one kid's playing video games and the other one, well, everybody's talking, and I was like, oh my God, I'm going to lose my mind. I can't handle this. I had to leave the room. And this is where, this is not an ad. I recommend everybody get Loop, L-O-O-P earbuds, especially for the summer, because they help block out a lot of extraneous sounds, and they have different levels. So I have their lowest level. So maybe the phone notifications aren't bothering me, or like the dogs are kind of quieted down, but I can still hear someone saying, hey, Mom, I need something. So any way that we can protect your nervous system is really important, which is what we'll talk about when we deep dive into nervous support. So the way out is regulation, but real regulation. And sometimes that means quieting down the house, quieting down yourself. There's lots of things that we can do, right? So we have to stop, though, and teach our body to learn that it's safe, even in the overstimulation. So maybe you leave the room, you do some EFT tapping or some breath work or some screaming into a pillow, right? There's something there. And the last piece real quick I want to mention on the mood driver is gut connection, because we cannot talk about mood and not talk about the gut, because they are deeply connected with the gut-brain axis. Now, people like to say that 90% of your serotonin is produced in your gut and not in your brain. And that's true, because your gut is actively involved in producing neurotransmitters, which is regulating inflammation, maintaining the integrity of the gut lining, and then if that gut lining becomes faulty, it's driving systemic inflammation that crosses that blood-brain barrier. It also travels up the vagus nerve back into the brain. But you know what? That serotonin that's produced in your gut is for your gut. It's not for your brain. And we talk a lot about this when we talk about insulin, which is next. So if you have IBS, if you have bloating, if you have food sensitivities, or maybe chronic use of antibiotics or birth control, your gut does have a piece in your brain story from an inflammatory immune perspective. Okay. The last driver that I love to hit on is insulin and blood sugar. And I think it gets the least respect, and it's also one of the most powerful. So our brain is incredibly sensitive to blood sugar swings. We all know this from feeling hangry, from feeling starving and unable to function, from feeling too full and sleepy and eating the wrong thing or irritated, right? So we have insulin receptors all over our brain as well. And when those get desensitized, which is what happens in chronic insulin resistance, your brain has trouble taking up glucose efficiently. Now, the research is calling Alzheimer's disease a type 3 diabetes because of how much insulin resistance shows up in the brain. So when you're skipping breakfast, you're having coffee with no protein, you do an aggressive intermittent fast because you're not hungry, you're nauseous, you don't feel good, you wake up, your brain's foggy, ugh. You crash maybe at like 11 a.m., maybe you hang in there till 1 p.m., and then you have the irritability. The anxiety comes on. You can't remember anything. You can't stay awake after lunch. This is a brain metabolic emergency. Is your brain screaming at you? It needs food, protein, support. So the fix here is really simple. And that's why I love talking about this driver, because eating protein and fat with breakfast within an hour of waking, stabilize your morning. Stop doing the strict intermittent fasting, especially if you're in perimenopause, especially if you're not sleeping well already, because it's making the cortisol problem worse. If we add in fiber, specifically soluble fiber, to slow your glucose response, we can also use targeted supplements like fiber. You can grab that as well. Berberine, magnesium, chromium, bergamot. All of these support insulin sensitivity directly. So I just want to spend a little bit on intermittent fasting piece because I get asked about this constantly. And it's really unfair because men intermittent fast, they lose weight, they feel great, they can do that all month long, all year long, and all the research is done there. So intermittent fasting in your 20s, maybe your 30s with a regular cycle and intact hormones, healthy hormones, is one situation. But intermittent fasting in your 40s or with hormone changes or with elevated cortisol, disrupted sleep, thyroid concerns, insomnia, stress, these are a completely different situation. So I'm not anti-fasting. I think there's absolutely uses for it. But for women, that usually looks like a 12-hour fast, which you're probably already doing, 9 p.m. to 9 a.m., or a more dedicated fast, which is a 24-hour. So if you want to take a 24-hour fast, I'd be okay with that versus not eating till 11 or not eating till 2 and then kind of binging at night. So if you're starting intermittent fasting, 1, because it's easy to skip breakfast, or 2, because everybody else is doing it, or 3, because your husband is doing it and he lost weight and feels great and he's doing cold plunges and you're doing all these things and you feel worse, it's because your biology is different, your nervous system is different, your cortisol patterning is different. It may suppress your thyroid function. It can make your reactive hypoglycemia worse. And this is, again, creating a chronic emergency energy system that you can't focus. So your fasting is actually making you foggy, which is telling you that it's not the right tool for you right now. So if this is you, grab a continual glucose monitor. They're everywhere now. And even just 2 weeks of wearing one can be eye-opening. You can start to see what foods are spiking your glucose. You can see your overnight pattern. You can see the relationship between sleep and stress and morning and exercise. and the data's right there on your phone, but you have to eat. That's really key. So once we have that data, we can make specific changes that move that needle. So there it is. Hormones, infections, sleep, mood, insulin, 5 drivers. Every single one of them is measurable, supportable, changeable, and not one of them is just stress and lose weight, is it? Not one of them is, well, just get used to it, you're getting older. Not one of them is, oh, well, that just happens to women when they become moms, right? There's something I want you to understand about this. They don't run in isolation either. They're running together, which is why we're grouping them together right now. Hormone shifts make you sleep worse. The poor sleep makes your blood sugar more reactive. The more reactive your blood sugar is, the more inflammation you have. The more inflammation you have feeds more inflammation in your brain. That brain inflammation makes the post-viral patterns worse, and around and around, around, around. So when you tell me that you don't know where to start, my answer is literally start anywhere, because one of these is connected to all of the others. Pick the one that feels most accessible to you, walk through it, and you'll be working on all 5 whether you mean to or not. If you want to take one thing away from this episode and use it this week, this is it. Tomorrow morning, wake up. Eat protein and fat within an hour of waking. Get 10 minutes of morning sunlight on your face. And do one thing for you before lunch, even if it's 5 slow breaths. That's it. Free. 10 minutes total, right? Having breakfast is key. And you might not see that difference in all of your symptoms for about a week or 2. So keep it up. But it's going to start moving the needle on 3 of those 5 drivers right away. And then we build across the rest of the series. So every single one of these is going to get its own deeper conversation across the next episodes. We'll go into post-viral brain, long COVID, Epstein Barr, what neuroinflammation actually looks like and how we treat it. Then we'll go into the brain hormone conversation about estrogen, progesterone, the thyroid, the gut, how all of this is running your brain behind the scenes. And then episode 4, we'll go into forgotten brain foundations like mood, blood sugar, sleep, the daily practices that change everything. So if you've made it to the end of this episode, I want you to do one thing for me. I want you to think about which of these 5 drivers hit the hardest when I name them. Which one made you say, oh, that's me. Well, I didn't know that, but wow, that's really important. I think I need to start there. This is where your body wants you to start. This is the information you need to start making those changes. So I've been building a program for anybody who's recognized themselves in this, someone who's ready to do something about their foggy brain with real framework and real support. And we're going to launch that on May 11th. So stay tuned. Make sure to follow me on Facebook, either Little Black Bag Medicine or my main page, which is my name, Alison Goggin. So in the meantime, if you want to work with me directly on any of this one-to-one, you can find me again at littleblackbagmedicine.com for functional medicine consultations, lab work, blood work, any functional labs that you want to get checked, cortisol, hormones, things like that, and ongoing care. So thank you so much for being here today. I'm so glad you listened in. Make sure to like, subscribe, and share this episode with anyone else who may be going through it with you too. Remember, you're doing a good job taking care of yourself. Keep it up, and we'll see you next time.